I guess it all boils down to your own personal experience with the NHS. And when we have good experience, we do shout from the rafters. I think it's a kind of an instinct, isn't it, to highlight the kind of treatment you have. There's something it just goes to the very kind of primal part of our minds that you're in distress, something's gone wrong and some people have helped you. But of course, on further analysis, the discussion is kind of slightly wider and bigger than that. May says the NHS is great and considering its enormous size does incredible things. However, the size is the issue and it's very easy to fall through the cracks. The bureaucracy, as you suggest, if it was that amazing, everyone around the world would have been copying it. Keith says, I've had the best treatment through the NHS, but also experienced the worst too. The reality is this is a one-size-fits-all model mostly, and this is where the problems arise. As generations live longer, populations increase, it will need to find a new way of dispensing healthcare. And of course, this all comes on the back of the story we're talking about here this afternoon. There is nothing special about the NHS, and the coronavirus pandemic should not be used to justify how it's organised. This is according to a new report from the Institute of Economic Affairs, who said there's no rational basis for the adulation the NHS is currently receiving and attacked confirmation bias on both sides of the political spectrum. The Labour Party reacted, as you might imagine, with absolute fury to this. They were not happy at all and suggested that Matt Hancock, the Health Secretary, should pay back 32,000 quid's worth of donations he received from the IEA's chairman. So why is the NHS sacrosanct? What's your experience? 0344 499 1000. In a moment, we'll chat to Dr Sarah Jarvis, GP and Clinical Director of Patient Access. First, Christian Niemitz, who's the author of the report and head of political economy at the IEA. Christian, good afternoon to you, sir.
Good afternoon.
Nice to have you with us. There's nothing special about the NHS. You do realise you're going to hell, sir?
Yeah, I think I have already, but nonetheless,
has it been a rough morning?
Well, yeah, my notifications on Twitter aren't particularly pretty at the moment, but
sure.
that's just par for the course. That just happens when you write about healthcare. Look, I'm making a fairly simple point in the report. I'm just comparing various healthcare systems around the world, describing how they work and how they've been performing during this pandemic. And I'm saying there's nothing special about either the NHS or in general NHS type systems. There's no reason to believe that they have done any better than any other type of system. If anything, we have one of the highest excess mortality rates in the world and also one of the highest case fatality rates among developed countries. So not brilliant.
Yeah. I mean, that wouldn't all be down to the NHS, of course.
No, absolutely not. And that's what I go into in the report. I'm saying a lot of it is about the overall government response. And so far, we just don't know yet how to disentangle these various factors. That's something which will only become clear over the course of the next couple of years. I'm just hoping that there will be more in-depth empirical research on this, which there won't be if you're only allowed to come to one conclusion, which is that the NHS is brilliant.
Sarah Jarvis, I mean, you worked for the NHS for many, many years. You're a GP. You know your way around hospitals and surgeries. What's your instinctive reaction when you hear that there's nothing special about the NHS, allowing for the fact that Christian isn't talking about the staff, he's talking about the system?
No, and I think that's the really big key. So in some respects, I do agree with Christian. For instance, in general practice, there's been systematic underfunding. The proportion of the NHS funding which has gone to general practice for the last 20, 25 years has dropped and dropped and dropped systematically, while at the same time, we've been trying really hard to do far, far more in terms of keeping people alive. And so much of the work that we do these days is in terms of preventive work. In other words, keeping people from getting diseases, or if they do get them, stopping them from getting complications. So the sort of sexy stuff, the really high-tech stuff is being done in hospitals, and funding there in real terms, indeed funding across the NHS has increased, but in relative terms there are some areas such as mental health services, such as general practice, where the funding has been systematically, relatively speaking, dropped. And, we do have problems. We have problems with cancer care and so on.
Yeah.
NICE does amazing things in terms of keeping things equitable. But the problem with that is that when you've only got limited funding, then people do fall through the cracks.
Yeah.
However, And I think this is really, really key. The reason I think that so many people are wedded to the NHS is partly because of the extraordinary people who work in it. And I can absolutely, and when I first saw that there's nothing special about the NHS, I couldn't bring myself to read it to begin with, because I was just so angry, because the staff have just been unbelievable, both in hospitals where they've worked under the most extraordinary pressures in intensive cares, where we've had people being shifted from their existing jobs all to work in areas which are not their specialty, and of course in general practice, where I've been horrified at the depth of feeling about general practice, saying, oh, they've closed their doors, they've done this, they've done that. Actually, what we have done, we had no PPE. I had an ex-trainee who basically rang me up and said, well, I've written my will. I've got 2 kids under 4, and I've written my will because at the time we didn't know how likely younger people were to die from COVID. And these staff were putting themselves out there all the time. We were operating to begin with a barrier of the closed door because we were ordered to, because we had no PPE. But we were absolutely seeing people right through. But if you then look at the US, where there are more than 26,000 Americans who die every year because of lack of health insurance, 1 in 11 people who go bankrupt does so because of healthcare costs, and 2/3 of people who go bankrupt say that healthcare costs are a major contributor. That, I think, is when we see it on a system-wide basis, the value of the NHS.
Yeah, and Christian, I would imagine you wouldn't depart from the point there that you're not advocating an American system, but underneath everything you're saying here is that you sense there is a better system in this country that we could have. Would that be fair?
Yes, that's a fair assessment. No, of course, I'm not advocating a US-style system. In fact, I've never met anyone who does. I think that's mostly a rhetorical straw man. It's a simple fact that apart from the US system, every developed country, every healthcare system in the developed world offers universal access, irrespective of ability to pay. That is, again, nothing special. That's something that all developed countries have achieved. And therefore, there's no reason not to look at alternatives elsewhere, either on the continent or in the developed parts of Asia.
And in terms of how we get there, we mentioned at the beginning of the programme a list of other countries whose clinical outcomes are better than ours, and I think according to the WHO we sit something like 20th on that league table. Most of those countries, as I think you've just said, also offer cradle-to-grave free healthcare. They just have different ways of doing it. So you're not suggesting, even if you didn't go with the American system, that there is a way of improving the NHS, but just changing the system. Is it as simple as that?
Yes, I mean, I've written a book on this 5 years ago in which I'm suggesting that we should, over time, move towards a social health insurance system. That is the type of system that you get in, for example, the Netherlands and Switzerland, with much better clinical outcomes. That's a system where everyone has private insurance, and you then get a market in healthcare provision. So it is a market-based system, but it's also a universal system. Because if you can't afford your insurance premiums, the government will pay them for you. Okay. And health insurers are not allowed to discriminate on the basis of your health status.
And is there more of a competitive element in there? A few people getting in touch with us saying it's the lack of competition within our health structures that causes some of the problems.
Yes, I think that makes perfect sense. And that's something that these systems avoid. They are competitive systems. There's intense competition between healthcare providers and between health insurers as well. But competition doesn't mean that they can't cooperate. It's like in any market, you still get integration, you still get cooperation between different providers. You can have both things at the same time.
And Sarah Jarvis, I mean, I know when the word, if you walk into a hospital or a doctor's surgery or speak to a GP or a surgeon in the NHS and you mention the word privatisation, the world ends at that point. Folk discombobulate and are naturally concerned. But as Christian is saying, we don't have, based on WHO league tables and other measures, we don't have the best health system in the world. So there is clearly there's a clearly reasonable argument to have something new or something different. And if that means it's a private contingent to it, but it's still free, is that okay? Are most clinicians, in your experience, relaxed about that when they think about it?
Well, I think one of the things we have to bear in mind is that the NHS, if you like, has been to some extent privatised in recent years anyway, and perhaps not in the right way. The simple fact of the matter is that, for instance, as GPs, we are now told what we can and can't prescribe. And there are a lot of medications where, for instance, people who would get a paracetamol tablets for 25p or 30p will come in and demand a prescription for them because they say, but that's free. And yet that costs the NHS, what, £20 for that prescription? Because by the time it's been written, dispensed, the prescribing fee for the dispensing fee for the pharmacist, it's gone to the prescription pricing authority, etc., etc. And I think that to an extent, we also need to look at everybody's responsibilities. And I think that some countries, perhaps the Netherlands and the Nordic countries, people have perhaps a little bit more of a sense of responsibility, of ownership of it.
Yeah.
Now, privatisation has not, of course, necessarily gone well, and indeed a huge amount in the NHS of the PFIs, the hospitals and things have had to close because actually the private company was put profit before quality. So I think that it needs to be done very carefully. And certainly, I think everybody in this country would be very right to be very, very worried about the idea of a system which did not offer free at the point of access care to everybody, regardless of means, on the basis of their need.
Sarah, thank you. And Christian, just a very final point. Just give us the name of one country that you think does it better than anyone else on the planet.
Sorry, I just lost you there. Can you repeat that question?
Yeah, could you just give us the name, in your opinion, through your research, which country does it better than anyone else?
Okay, that's a tricky question. There is no single system that is better consistently across the board. But if it were up to me, I would adopt a blend of various systems, a blend of the Netherlands, of Switzerland, maybe Taiwan, maybe Australia. So Israel, I'd have a look at a couple of systems and try to blend the best bits of all of them.
Okay, Christian, thank you. Christian Niemitz, who is the author of that report, the head of political economy at the IEA. It was that report where the NHS was called nothing special. The other voice you heard, of course, was Dr Sarah Jarvis, GP and Clinical Director of Patient Access. 0344 499 1000. I want your views, experience, what it's been like at the coalface of treatment with the NHS, the good, and of course when it's not been so good. What's been your view there, which is the nitty gritty of what we're talking about here?